chart is called safe and unsafe touching. And they have grouped the different parts of the body to bad touch, may not like, which is in yellow, and a good touch. So bad touch is in red, may not like is yellow, and then good touch is green. So green on this diagram, the green is actually only over the hands. So in terms of like shaking hands, okay, that is considered a good touch. So when someone touches you on hand, it is considered okay. It's still acceptable. Then we have the yellow touch, the may not like touch. So any of the other parts of your body, when someone is touching you, you may not like it. Okay, depending on whether this person is in the inner circle or whether you even feel comfortable with this person touching you. So the places that you may not like will include your face, your neck, your shoulders, your stomach, your knees, and your feet. Some people also do not like their head to be touched. Okay, so it really depends on the person. And then bad touch is in this diagram, they show the chest and the genitals. Although this chart actually say good and bad touch, I don't really think touching your genitals is a bad thing, provided that there is consent. So I would define the red parts as not necessarily bad, but I would define it as private touch. So this includes your private parts, your chest, your breast, and your genitals. So be mindful when someone is touching you those places, because this is actually a form of sexual assault if you are not consenting. Whereas the other yellow parts, you can argue it's not sexual. I think we know that when someone touches you in a friendly way, like someone bumps you on the shoulder, that is not intentional. We can kind of feel it in our body. So this is something that we get better as we get older. However, just be wary when somebody is touching you in your private areas without asking for permission, without you agreeing to them touching you there. It is definitely a red flag as well. So we call it safe and unsafe touching. And then here, the next diagram, we have a traffic light system of red, yellow, green. Red means no, yellow means maybe, I don't know, yes is yes. So yes is not just verbal yes, it's also true non-verbal. In cases of doubt, it is better to be as explicit as possible. When someone is saying no, maybe, I don't know, or someone is quiet, don't take it for granted. It is better to stop when unsure. When someone says no, then definitely, of course, stop. The next chart, we're actually showing the different stages of childhood development, the kind of questions that needs to be tackled when you're at preschool, when you're between the ages of 5 to 8, ages of 9 to 12, ages of 13 to 15, and so on, 16 to 20. So this is when we go through the life cycle. And as we get older, we may develop different maturity level, intellectually as well. And so we may have different questions around our sexuality. Okay, so now I'm going to go into puberty. So in puberty, when boys grow into men, their bodies will change. And these are some of the changes. They will grow taller, they will have a deeper voice. They may grow facial hair, and the hair may also appear in their testicles and pubic area. They may become more interested in boys or girls. The sweat can start to create an odor. When they perspire, they notice that they smell. They may become stronger. Some things about erections for people with penises is that when they are sexy thoughts or feelings, they watch certain movie or something, it can cause the blood to flow into the penis. The blood flow to the penis is what causes the penis to get harder and longer. Erection is more common during puberty. Erections are normal and can happen, and also can happen during inappropriate times. So erections are private. This is your private part. And sometimes you can feel the erection, but actually people around you may not be able to see the erection. So I think a lot of times we may be very conscious about it. As you get older, the erections will be easier to control. When girls grow into women, their bodies also change. So these are some of the changes to girls. They will grow taller, they may develop wider hips, they will go through menstruation, they will grow breasts, they may grow hair on their armpits, pubic area, they may be more interested in boys or girls. And they will also, when they sweat, they will notice like the smell is different. So these are all the hormonal changes that is happening. So a little bit about menstruation. Menstruation is what happens when blood flows from inside the body, from the opening between your legs, your vagina. So we have the urethra where you pee from, we have the vagina, and then we have the anus. So the vagina is between the urethra and the anus. The menstruation is also called having a period. So menstrual blood or period blood is a sign your body is healthy and working as it should, because you are not pregnant, so your body is shedding this blood. The period will come every month for most people, and will last between 4 to 7 days. So every 28 days or so, period will come. Menstruation is something private, but it's not something to be ashamed of. It's just a normal part of your body. So cleanliness, of course, is an important part of keeping yourself smelling clean and fresh. So in this diagram here, they have the follicle phase. This is when the egg is being released, is developing. The ovary is maturing one egg every month. So the egg is being developed, and at the ovulation phase, the second phase, the egg is being released from the ovary. It is one from one side of the ovaries, so we have two. So one egg is being released every month, and this is during the ovulation phase. If you are not pregnant, if the sperm did not travel and get in contact with the egg, then what happens is the body will know, okay, you're not pregnant, and then the shedding will happen. So there's the luteal phase when the eggs get released, and then there's the menstrual phase where the endometrium will shed. So this is the perception of blood, but in reality it's not really blood. Blood is actually full of a lot of very good nutrients that was meant for the baby if you are pregnant. Okay, so some of the side effects of menstruation can include abdominal swelling, mood swings, headache, flushing, that means perspiring a lot, and abdominal pain, okay, swelling and pain. So masturbation, what is masturbation? So when your body has changed, you may touch your body to explore what feels good. Our genitals are full of nerve endings. That's why people masturbate by touching their private parts, their breasts or their genitals. Our private parts are sensitive, and people explore it in different ways. Some people use a vibrator, which is basically a device that shakes. The whole point of using a vibrator is also so that you don't get tired pleasuring yourself. I'm going to go more into sexual arousal. So let me finish this part about manual stimulation. As part of masturbation, you can, of course, stimulate yourself with your own hand. You can stimulate with the help of a dildo, which is a phallic-looking object that doesn't vibrate, or a vibrator, something that shakes, usually with a battery inside. And afterwards, do wash your hands. If you explore your body, touch yourself, do wash your hands so that there's a reduced chance of spreading a sexually transmitted disease if you got one. So imagine you were sexual with someone, and then you have the disease in your genitals, and from touching your genitals, you go and rub your eyes, you may be spreading the STI to other parts of your body. So as a good practice, it's always good to wash your hands after you touch yourself. But if you have never been sexual with someone, then of course you will not pass anything to yourself. Okay, so this slide is on penetrative vaginal sex. So what this means is when the penis goes into the vagina, that is what we call a penetrative sex or penetrative vaginal sex. So during vaginal sex, what happens is the penis goes into the vagina. In order for the penis to go into the vagina to prevent a pain, so foreplay is very important because it gets both of you sexually aroused and ready so that vaginal sex is more enjoyable. In order to not get pregnant and not to pass any diseases, then the most common way is to have sex with a condom. So having sex without a condom will put you and your partner at risk of pregnancy and sexually transmitted infections, including HIV. Condoms, what they call it, external condoms or male condoms, is actually the most common form of protection against unplanned pregnancy. So external condoms, male condoms are very easily accessible. We will go more into the different types of contraception. So for condoms to work effectively, they need to be in place before the penis touches or enters the vagina. So there's no point if you already did the rubbing and then the semen may have already entered the vagina. That may also be a risk of pregnancy. So to get erect, then put on the condom before going into the vagina. So discussing safer sex is an important part of having sex. So before you have sex with a partner, to actually talk to your partner about something along the lines of, if we have sex, you know, we will use a condom. Are you comfortable with using a condom? You can say things along those lines, okay? That is the responsible way to bring up the topic of safer sex. A little bit about cleanliness. So of course, before sex, washing yourself, cleaning your genitals will help to prevent bacteria infection. You use the condom on the penis, and you can use a piece of latex or plastic wrap for a woman to prevent STDs. Okay, so there is this device called the dental dam. It can be used to cover the genitals of the woman so that oral sex will have a kind of barrier. But what happens is that in Singapore, they don't really sell this. You can look into creating your own dental dams. For instance, you can use, like they said, you can use a plastic wrap. You know, the microwave film. You can actually put the microwave film over the genitals before oral sex as well. That is also a form of barrier, although there is some disagreement around the effectiveness. You can actually also learn to create your own dental dam by cutting the male condom as well. So we are not going to go into so much details. However, I think we will just focus on the fact that if you need to create or make a dental dam, you can actually find this information online. In Singapore, a lot of people actually don't know that there's even such a thing. Okay, the condom should not have spermicide on it. So what happens is, in the past, they put a spermicide in condoms. The spermicide will kill the sperm. And what they have found with spermicide is that it will irritate the vagina. And so condoms should not have spermicide inside. Even though it may kill the sperm, it seems to be good. But when you buy a condom, just look and check that there's no spermicide. You'll be surprised, they are actually still selling condoms with spermicide in Singapore. But I think Durex, you know, is a pretty safe brand. I haven't found any spermicide in their brand so far. Okay, so you can actually use a condom over your toy as well if you want the ease of cleanliness and the ease with cleaning up. You can actually put a condom over your toy. Okay, now a little bit about anal sex. The term anal sex basically means when there is penetration or stimulation inside the anus. It can be stimulating for male and female because the entrance of the anus is full of nerve endings. So being clean is important. You can just use water and soap as part of your washing up. You can use a wet wipe and then you play with this area. But do know that even though it's quite a strong area of our body, it can still be sensitive and delicate. So you can play with your anus using your finger, your hand, your with an erect penis or with sexual aids. And the anus is not self-lubricating, so you definitely want to use water-based lubricant, and you may want to also use a condom as an additional way to protect yourself against any bacterial transfer, irritation. Okay, so this slide actually says, this cartoon, your partner does not define your sexuality. I think a lot of us feel that, you know, if you don't have a partner, you're not a sexy person or you're not a sexual person. You can be sexual by yourself. And your partner should not be telling you right and wrong things to be doing. The right and wrong things are the things that you yourself needs to feel comfortable with. So having a partner doesn't mean anything, especially if your partner is not being kind to you. If your partner is bullying you and telling you certain things like, oh, other people can, how come you cannot? Things like that. Okay, so don't let your partner bully you. Don't let your partner tell you what is right and wrong around your sexuality. Our sexuality is defined by ourselves. We get to decide who we are and how sexual we want to be and what way we want to be sexual in. It's not up to your partner. You are just sharing your body, your sexuality with your partner. You are letting them into your life, but they don't get to decide for you. So I'm emphasizing on this because I think a lot of us, when especially when I was like, you know, when we were younger, we are still questioning ourselves and we are still navigating life. So there's a lot of uncertainty. So I felt that this was very important to talk about, that whether you have a partner or not, it doesn't make you any less of a person, and they shouldn't be telling you what is right and wrong around your sexuality either. Okay, a little bit about sexuality, a little bit more. Okay, there are different stages of the sexual response cycle. There's a desire. You know, desire is when you have that want. You want to do something with this person or by yourself. You have a curiosity, for instance. So the desire is there, the curiosity is there, the urge is there. Maybe you start off feeling a little bit horny is there. And then you start to touch yourself, you explore yourself, and then the excitement starts to build up. The sensation, the feel good starts to build up. So that's the term that we use in my work. The desire leads to excitement. And then as the excitement starts to build up, you go into this phase, we call it the plateau. So plateau is when your excitement is building up and you have that feeling like something is going to happen. And you are at plateau, you're cruising along, and then you know if you continue, something is going to happen. So that's plateau. And then an orgasm after plateau is when there's a build up of sexual tension and energy. There's a build up, and then there's a release. So some people call it the sexual peak, they call it the orgasm. With the orgasm, you may feel goosebumps, you may feel like you're trembling, you're shaking, you may feel that there's like a mini explosion in your body cascading through. And the orgasm actually only lasts for a few seconds, whether you are male or female. And after orgasm, your body will very quickly start to go into resolution. So I've actually had several clients who identify as women. They actually are not sure whether they have ever had an orgasm. So what they describe to me about orgasm is it feels like, it feels good, the touching, the rubbing, it feels good. And then all of a sudden, they don't know what happened. They just feel very relaxed. So they don't even have a very definitive peak or orgasm. They don't have a definitive one. It doesn't feel like a mini explosion in their bodies. But they definitely feel the sudden relaxation, the resolution. So everybody's bodies is different. And the traditional way that we have come to associate the ability to have orgasm is the stimulation of the genitals, but not everybody orgasm in this way. There are people who can orgasm For instance, people with who are in wheelchairs, who have had spinal cord injuries, they have had their bodies rewired so that other parts of their body compensate and like become more sensitive. So for instance, maybe they have cerebral palsy, or maybe they have a spinal cord injury, and they may notice that their sensation just their body is sensitive in other areas that is not traditionally known by most people. So for instance, they may be very orgasmic at the back of their necks, or even their ears can be very sensitive. So this sensation of orgasm is an internal sensation. It's not for anybody to say, oh, you're weird, or how come you're like that, because our body is so amazing and so adaptable that you can actually learn to have orgasm in so many ways, that it's not just about the use of your genitals. So I hope I talked a little bit about this. Maybe it's a bit scientific, but it's really important to show this to you, because I want you to understand that actually there are people who have sexual difficulties in each stage. Some people don't really feel desire. Some people feel the desire, but they don't really feel excited, no matter what they do. Some people feel excited, but they are stuck at a plateau. They don't actually have an orgasm. They're at plateau. Some people can have orgasm, but maybe they don't feel that it's a very strong orgasm. So at each stage of the way, people will have different kinds of challenges, but it doesn't make it any less special to experiment with your body. It's a wonderful thing that we have, that our body is like a playground for us to enjoy. Being sexual by yourself is a form of safe sex. Okay, so now talk a little bit about sexual arousal. So arousal can involve thinking. You think sexy thoughts, you see something sexual like porn, you touch yourself, you play with toys, you are getting external stimulation, for instance, like kissing or like watching certain sites. All these can cause you to get sexually excited, and this may result in vaginal lubrication. The people with penises may also have what they call pre-cum, right? So this is when the body is producing liquid to prepare you for ejaculation. So the pre-cum is different from the semen. It's different. Okay, it's a different liquid and comes from a different place of the body. So just a little shout out about sites, right? Because I mentioned very quickly about porn. Porn in Singapore is not illegal. It's not illegal to watch porn online. Okay, I repeat, it's not illegal to watch porn online. What is illegal is when you download it into Singapore. That means you download it into your phone. It is considered illegal. Okay, so there is always the risk or chance, you know, like government like raid your house and then find that you have thousands of porn clips and everything. Even though it's for personal consumption, it's considered illegal. So online porn is actually legal. And also I know like a lot of people, they find porn really disgusting. There are actually websites where they have audio porn. It's just audio, there's no visual. So, that can be great for people. Actually, because of COVID, audio porn, audio erotica has become very popular, because a lot of people, they are surrounded by, you know, other members of the family or housemates or whatever. So audio porn gives them the privacy to be sexual by themselves. And then there's ethical porn. So ethical porn is when everybody in the movie agrees to every single sexual act and are paid fair wages. So there's ethical porn. And then there's also such a thing called feminist porn. So feminist porn is when the person in the movie actually agrees to every single act, and also does it from a place of empowerment. So the style, the feel, the way it's filmed is very, very different. So I actually would question somebody who doesn't care about the porn they are consuming and doesn't care about whether the performer in the film actually has consent. I will question these kind of people that I'm dating, because I feel like performers, just like actors, actresses, singers, they do deserve to be paid for their work. Okay, so the next slide is on sexual arousal for people with penises. Blood flows into, I think we talked about it already. The blood will flow into the penis, erectile tissue of the penis, causing erection. So some of the other changes that can happen to the body, the muscles will tighten, the nipples will become erect, the blood pressure and the heart rate will go up, and the amount of arousal will affect the ability to get and sustain erection. And for people with vaginas, the arousal will happen similarly. The blood will flow to the genitals, causing engorgement, and the secretion or vaginal secretion. It will cause the muscles to tighten, the nipples to get erect, and the blood pressure and heart rate will go up. So there's this sense of like more and more excitement and anticipation. Other parts of the body that can feel exciting besides genitals will include the neck, the breast, the ears, basically any part of the body that feels good for you. That is what I call the outer and the inner. So there's the part of my arm that is facing the world, the outside, and then there's the inner. So the inner side of my arms, the inner side of my thighs will usually be more sensitive than the outer. Okay, so orgasm, as I mentioned just now, is a build-up of sensation. It can cause a series of muscle contraction and pleasurable feelings, ejaculation of semen, and some people with vaginas may have a gush of fluid. So they call it squirting, they call it female ejaculation. So this is a real thing that can happen. So there are people who they are very close to having an orgasm and then they feel like they want to pee. So if they let this liquid be released, they may realize that actually this liquid is not pee. So one of the ways to test it is you taste a little bit of it. It's actually created by the body to help with you to feel to feel good. Yeah. Okay. So here are some myths. Okay. So these are all wrong. All wrong. It's not true. It's not true that you can get pregnant from sitting on non-covered toilet seat. Okay. It's also not true that you can catch that HIV through uncovered toilet seats. You can get pregnant from oral or anal sex. It's not true. You need sperm to get pregnant. Men can always tell if you're going to get pregnant or you are pregnant. Not true. Women can control getting pregnant. Not true. Sex is safe if the man pulls out before he comes. Okay, if the man pulls out before he ejaculates, it's called withdrawal. Okay, withdrawal. And it's not true. Some of the semen can spill out, so the person can still get pregnant. So oral sex is not real sex. It's not true. Okay, oral sex is a form of sex. It is safe to use condom more than once. Not true. Please don't reuse your condoms. You can't get pregnant the first time. Not true. You can get pregnant. You can get discharged from watching porn in your room. Okay, I don't know what it means by you can get discharged for watching porn. Get fined. Not true. As I mentioned, watching porn is not illegal in Singapore. It's just downloading. You can't get an STI if you wash with soap and water. It's not true. Even if you wash soap and water immediately after sex, you can still catch the STI. It may just reduce the chances, but you can still get. Okay, blue balls can make any guy very sick. Okay, blue balls means the person is sexually very aroused but does not release the ejaculation. So that's the term blue balls. And it's not true that blue balls will cause the person to be sick. Just because you are playing with your partner and your partner has an erection, you don't have to feel that you need to satisfy your partner, please your partner, help your partner to ejaculate just because they are erect. So don't have this good girl syndrome, okay, or good boy syndrome. Washing. So you can wash your genitals before after sex. It helps to prevent skin breakdown, bladder, vaginal infections. Peeing before after sex, body fluids before after sex can irritate. It's true, some people's body fluid can irritate the skin. That's why you wash it. Lotions and lubricants can irritate the skin. It's true, some lubricants can irritate depending on your sensitivity. So usually I would prefer to get the organic plant-based lubricants suitable for people with sensitive skin. But some people are okay. So it's a matter of trying.